Hi, my son has been having some neck and back stiffness, and he's also been having difficulty swallowing and weird reflexes lately. Do you know if he has any diseases or anything?
From your description, it seems like your son may have the polio virus, and I'll go ahead and grab someone to get some samples.
Okay. Anyways, what is this polio virus?
Polio is a viral disease that can cause paralysis and muscle wasting. It's highly infectious and mostly affects young children. It's transmitted by person to person through contaminated food and water and or contact with an infected person.
I'm sorry to say, but the results show that your son does indeed have polio.
Oh, so what should I do now?
We'll do more testing, and I'll call a doctor in. And your son may experience some symptoms along with the polio virus. He can experience fever, sore throat, back and neck pain, and stiffness. These may last 1 to 10 days, so if it occurs really badly, then you can come back to the hospital.
Hi, nice to meet you. Okay, so I heard that your son has polio and I'm very sorry about that. But there's two different vaccines that we implement. There's the IPV, which is the injection in the leg or arm, and it actually depends on the age of your child. And there's another one which is the OPV, which is taken orally, and that one is a weakened strain of all three different poliovirus. So with the IPV, that's an active poliovirus injection, and it's actually very safe. And there's some side effects that can happen, like fever, joint pain, body aches, and from time to time they can feel drowsy or even vomit. But otherwise, it's nothing really serious. But the OPV one, the one that's taken orally, has some very rare side effects that are quite dangerous. Some of them can lead to paralytic polio from the vaccine, but that's about 3 per million doses. So it's actually very rare. Okay, so the prognosis of polio usually is known by the damage that's caused by the virus. Most of the time, people have a positive prognosis because when they're checked and recover with no complications, even though some of them have a few symptoms. But when patients do have paralytic polio, the range varies more widely for some patients because most of them have higher chance of being disabled for the rest of their lives. Those patients that show the symptoms of paralysis, it's usually followed by hard time breathing and swallowing it when their prognosis worsens. With the use of vaccines, there's a more higher chance of returning back to a healthy, normal life, more usual activities, and not such a hard time with the virus and the disease. So I suggest that we get started on early treatment. And nice to meet you.
Thank you.
There are 2 types of polio vaccine that are effective in defending against polio. The first type is inactive vaccine, IPV. An injection in the leg or arm depends on the age of the patient. The second vaccine is oral poliovirus vaccine, OPV. It is administered through the mouth. The goal of these vaccines is to produce and regulate its own antibodies against the viruses that result in polio, so children are not affected and are able to live a healthy life.
Polio virus. I don't know. Bye bye.